Welcome to Pregnancy and Postpartum TV. Today we're going to talk about the changes of your vagina after birth or childbirth. So a lot of women have a lot of fears around the changes of their vagina. So they're worried that it may become looser or wider or more open, even that their partner may be able to feel a difference. Of course, they're worried about the pain. How painful is it going to be? How long is it going to last? Is sex going to feel the same or still be enjoyable? However, this video is designed to make you feel better. Our vagina is an amazing organ with amazing stretching and lengthening capabilities, but also shrinking and healing capabilities. The first temporary change that you may notice is that your vagina right after birth is going to feel and look more open. It may look wider, it may feel more loose. However, this tightens up within a couple of days mostly, and then over the next few months, especially if you're doing your pelvic floor exercises or Kegels, this can go a long way to bring back the regular size and tone of your vagina. One study showed that 80 to 90% of women felt that they got back to 90% of their previous size. If by 3 or 4 months you are not seeing the improvement that you were hoping for, I highly recommend a pelvic floor physical therapist. I will also link to a video with some pelvic floor exercises that you can do as well. Another temporary change that you might see is darkening of the vulva, specifically the perineum and the labia. So due to the hormonal changes, you may see some darkening or hyperpigmentation, but this should go away in 6 to 12 months. Change number 3 is that you can have soreness, pain, bruising, swelling from pushing the baby out. However, if you don't have tearing, you don't have episiotomy, this really starts to improve within hours and especially days right after your birth. There are lots of things that you can do to make it more comfortable for yourself. You can use cold packs to help with swelling or bruising, or you can make your own padsicles. You can use sit baths and sort of sit in a bath of warm water to encourage healing. You can also use a peri bottle, which is just a bottle that you fill up with warm water, and instead of wiping where it might be sore, you can actually just rinse yourself gently with warm water. It's also helpful to have a plan to avoid constipation postpartum. You definitely don't want to be straining during that time. And of course, talk to your provider about pain medication if you feel that you're not coping. The fourth change that you will notice, whether you had a vaginal delivery or a cesarean section, is lochia or vaginal discharge. So this is going to start out as a combination of blood and mucus that you need to get rid of, and on average it's going to last about 5 weeks. About 15% of mothers continue on to 6 weeks or a little bit after that. It's going to start out red and then get lighter to a more pink, turn into more brown, and then eventually go to a yellowish or clear color. Of course, you also want to keep an eye out that you're not having any postpartum hemorrhage. You want to make sure that you're not soaking through your pad in less than 2 hours. You may pass some small clots, but they should not be larger than the size of a small plum. And also, if you're having any bright red bleeding past the 3rd day, that could be a sign and want to contact your provider. The 5th temporary change is vaginal dryness. From lower estrogen levels and also from breastfeeding, your vagina may feel more dry. So feel free to use a lubricant. My personal favorite is an organic sweet almond oil. However, if you're using condoms, then you will want to use a water-based lubricant, and also ask a provider for a lubricant that fits your needs. After you are done breastfeeding, this should return to normal. The 6th temporary change is that sex can feel uncomfortable. Of course, you want to wait at least 6 weeks and then get clearance from your provider. However, you may need to wait longer, especially if you had any tearing or you had an episiotomy. The uncomfortableness can be from the dryness that we just talked about, but also from the changes to the pelvic floor muscles. So again, doing your pelvic floor exercises, seeing a pelvic floor physiotherapist can be really beneficial. If you are experiencing pain, that is not normal, and so that's when you would want to go seek professional help. The last temporary change that I'm going to talk about is urinary incontinence. So of course, right after your birth, it may be a little bit harder to control this, and over the next few months, as you practice your pelvic floor exercises, it will take some time to regain full control. It is joked about a little bit that mothers may leak a little bit when they sneeze or jump or laugh. However, with the proper treatment, most women can regain complete control, and so they're not having lifelong leaking issues. So those are the more temporary changes, and honestly, our vaginas are amazing and they really return after several months to feel really normal and good again, to a place that you can feel really happy and comfortable about, especially if you're doing all of your exercise and everything. So I do want to talk about the more permanent changes that can happen. It doesn't mean that it's going to happen to you, and I'm also going to talk about the things that you can do to try to reduce your risk of the permanent changes, which would be from tearing or having an episiotomy. So the number one thing to reduce your risk of tearing is actually to prevent having an episiotomy. So what you can do is talk to your provider about this and ensure that you're using a provider that tries to avoid using episiotomy or a cut in the perineum at all costs, unless it's an emergency and they absolutely need to do it. So depending on where you live, what country you live, there are different ideologies around this. However, research does very clearly show that the biggest risk of a severe tear, so a 3rd or 4th degree tear, so 1st degree tear is just sort of grazing of the skin, 2nd degree tear is going to go into the muscle a little bit, probably requires some stitches. A 3rd degree tear is going to go into the muscle of the anus, and then 4th is going to go through to the tissue. So we definitely want to avoid 3rd and 4th degree tears. Years ago, it was thought that an episiotomy would prevent severe tearing. However, in randomized control studies where women were assigned to either episiotomy or not episiotomy, it was found that the group that got the episiotomy had more 3rd and 4th degree tears. You can think about if you have a piece of material and you pull on it. If you put a cut in that material and then pull on it, it's much easier to tear that apart. I have another video that I will link to that talks about all the things that you can do to decrease tearing. Birth position is also important, so birthing on hands and knees or side lying, as well as not holding your breath. When you are pushing, you want to exhale and let your body do the pushing. Don't go too quickly to help reduce your risk of tearing. Taking these precautions, the risk of having a severe tear is actually quite low. Many, especially first-time moms, will have a not severe tear, so a 1st or 2nd degree tear, which really is like a 1st degree tear is really just grazing of the skin and is really not a big deal at all. If you do have a tear or an episiotomy, then you will have a scar. After your scar has healed, you can do scar massage. I talked about this in another video, doing C-section scar massage, and you want to sensitize the area, and this will prevent sort of numbness or weird feeling around the scar and promote more normal healing. The vagina is really remarkable, and while it may not get back 100% to how it was pre-pregnancy, especially a few months later, within 6 to 12 months for sure, it should get very, very close. And if you focus on your pelvic floor exercises, especially if you didn't do that pre-pregnancy, it can even feel stronger and feel better than pre-pregnancy. If you have any other questions, feel free to put them in the comments below. I'm also going to link to my natural birth preparation list in the description box below, and I will keep making pregnancy workouts, yoga, Pilates every week. If you like videos like these, subscribe, hit the notification bell, share this out with another pregnant mom friend that you think would be helpful for.